Okay, let's dive right into this explainer. I've got something today that is absolutely going to blow your mind, and honestly, it completely shifted how I look at healthcare. We're unpacking the hidden mechanics of medical innovation, and maybe more importantly, the invisible barriers holding it back. Because, look, we live in this era of just unbelievable scientific advancement, right? But there is this stunning disconnect between what's medically possible and what actually happens in the doctor's office. To really set the stage here, just imagine, God forbid, you or someone you love needs a brutal, life-altering surgery. You go through it only to find out way later that a 15-minute outpatient procedure could have fixed the exact same problem without a single cut. No way, right? But this isn't some hypothetical scenario. This is happening right now. Because the greatest treatments in the world are literally useless if the medical establishment doesn't adopt them, or if we, the patients, don't even know they exist. Here's our roadmap for today. First, we'll look at the minimally invasive revolution. Next, miracles in gastroenterology, followed by reversing deadly strokes. Then, we're going to figure out exactly why doctors resist change, and finally, wrap up with adopting a new medical mindset. Section 1. The minimally invasive revolution. We are currently living through a massive paradigm shift. I mean, we are rapidly moving away from these traumatic open surgeries that require weeks of agonizing recovery and moving toward revolutionary, minimally invasive techniques. Using advanced scopes and tiny instruments, doctors are doing complex interventions from the inside out. The result? Patients are pretty much ready to go home immediately. It's incredible.
Section 2. Miracles in Gastroenterology. So pioneers like Dr. Frank Gress and Dr. Scott Tenner are leading this exact charge using tech like RFA, or radiofrequency ablation. Basically, if a patient has a precancerous condition like Barrett's esophagus, doctors can now use an endoscope to literally scrape off the bad cells. No scalpels, no cutting. The whole shebang takes about 15 minutes.
To put that into perspective, think about the old way of treating this. It meant going to the operating room, having the bottom third of your esophagus completely removed, and then yanking the stomach up into the chest to reattach it. You'd spend 5 days in the hospital, face a month of brutal recovery, and deal with a lifelong condition called dumping syndrome. Contrast that life-shattering ordeal with the new way, a 15-minute procedure where you just walk out and go home the exact same day. It's a total game changer. But the miracles absolutely do not stop at the esophagus. Listen to this stat, because it's staggering. Out of the 50,000 colon cancer deaths that happen every single year in America, 45,000 of them are entirely preventable by a routine colonoscopy. We literally have the technology to find an embryonic cancer and just pluck it out before it ever becomes deadly. I was just amazed reading this part of the source material. Dr. Tenner's exasperation really jumps out. He asks, what more remarkable miracle do you want than being able to prevent 95% of colon cancer? And it perfectly captures the passion of these innovators. They hold the tools to eradicate a disease, but they keep slamming into systemic roadblocks. We essentially have a cure for one of our deadliest cancers, yet people are still dying just because of a lack of screening, fear of the actual procedure, or systemic resistance. Section 3. Reversing deadly strokes. Now we're entering the high-stakes realm of the brain with interventional neuroradiologists like Dr. Sandeep Mangla. But first, we need to understand the enemy here. An ischemic stroke happens when blood flow to the brain gets blocked, usually by a clot traveling up there. And since the brain doesn't store oxygen or glucose, even a few minutes without blood leads to rapid, permanent tissue death. We're talking paralysis, loss of speech, or much worse. Let's contrast the old, agonizingly limited approach with what we can do today. Back in the 1980s, neurology was grimly summarized as diagnose and adios. A doctor would confirm you had a stroke, hand you an aspirin, and basically just hope for the best. The only other option? Cracking open the skull. Yikes. But today, doctors like Mangla make a 1 mm incision in the groin and send tiny tools directly up through the body into the brain. It really is like a miniature rescue mission, like something straight out of a sci-fi movie. First, they insert a catheter into the femoral artery down in the groin. Then, they carefully navigate it all the way up into the wildly complex blood vessels of the brain. Next, they use this tiny corkscrew device to literally snare the clot, or a microvacuum to just suck it right out. Finally, blood flow is restored. There are patients who arrive completely paralyzed and literally walk out of the hospital a few days later. It's mind-blowing. And this isn't just for blocked arteries either. For hemorrhagic strokes, that's where an aneurysm bursts and bleeds into the brain. Doctors can use a catheter to snake a tiny platinum coil up there to plug it up. It's kind of like stuffing a rat hole with steel wool.
This seemingly simple fix gives a massive 7.3% absolute risk reduction in deadly rebleeding, especially when you compare it to the old method of sawing the skull open and physically clipping the artery.
Section 4. Why doctors resist change.
Okay, so if these are undisputable miracles, why on earth aren't they the standard everywhere? Well, we have to look objectively at the structural friction points. Medicine is an inherently conservative field. Doctors tend to rely on what they already know and what they're comfortable doing rather than constantly learning new techniques. Plus, there's a massive lack of awareness, sometimes even between doctors working in the exact same hospital. Add in some political and economic roadblocks, and you've got a bottleneck. But honestly, the most jarring friction point often comes down to economics. The financial incentives frequently favor traditional invasive surgeries over these newer, quicker methods.
Let's look at a chilling real-world example, the Stretta procedure. This was a non-invasive scope procedure designed to cure severe acid reflux, basically eliminating the need for daily meds or major surgery. It was hailed as an absolute miracle. And yet, the company went bankrupt. Why? Well, patients just preferred taking a familiar pill, and doctors wanted to stick to what they already knew. It just goes to show you that having the best medical technology in the world doesn't guarantee anybody will actually use it.
And this builds on a deeply historical pattern. The medical establishment has pretty much always resisted change. Get this, back in the mid-1700s, it took the British Navy 40 years to start stocking ships with limes to prevent scurvy. 40 years. And in 1867, it took 2 decades just to convince surgeons to wash their hands and use antiseptics. Today's high-tech miracles are facing that exact same human inertia. The numbers really don't lie here. Look at this stark comparison for that life-saving aneurysm coiling procedure we just talked about. In Europe, about 90% of aneurysms are coiled off with a non-invasive catheter. But in the United States, it's only about 60%. When the source material asks why the US trails so far behind in adopting this obviously safer method, the answer was remarkably blunt: economic incentive. The profit incentive for doing a certain type of surgical repair can completely drive a hospital's choice of method.
Section 5. A new medical mindset.
So how do we break out of this paradox? The absolutely crucial takeaway here is that the days of just blindly following authority in medicine have got to end. We can't just assume the specialist sitting across from us knows about or is even willing to offer the newest, least invasive procedure. Patients and their families have to become their own relentless advocates. You've got to demand an open mind and insist on treatments backed by the newest evidence, not just the oldest habits. What's really wild is that even doctors themselves feel the weight of this broken system. The author of our source text, who is a doctor himself, had this profound realization when he discovered Dr. Mangla's catheter miracles happening in his very own hospital. He hadn't been referring his stroke patients to these life-saving procedures simply because he didn't know they existed. As he put it, he hopes whatever invisible scorekeeper there is in the universe doesn't send him to the nether regions of hell for being ignorant. The burden of medical ignorance is heavy, and the system isn't going to fix itself. So I'll leave you with this final thought. We live in an age where science fiction has literally become medical reality. The tools to save your life without tearing your body apart probably already exist. But the ultimate responsibility to find them, that might just rest on your shoulders. It's up to you to ask the hard questions, seek second opinions, and demand the absolute best care available. Because in today's medical landscape, keeping an open mind doesn't just expand your horizons, it could literally save your life. Thanks for joining me for this explainer. Stay curious, and I'll catch you next time.